Monkeypox Outbreak Presentation by Cindy, Sophia, Erica, Natalie, Joanna, and Abigail.
Today we'll be diving into the details of the recent monkeypox outbreak, going over what it is, the cultural impacts, and nursing implications. First, what is monkeypox? Monkeypox is a contact-transmitted disease that consists of symptoms like raised blisters, rashes, muscle aches, fevers, and chills. While many do recover on their own within 2 to 4 weeks, the rapid rise of infection is what is of concern. Monkeypox often have sporadic epidemics, as symptoms only appear after 6 to 21 days of being exposed. The outbreak we are specifically covering is the July 2022 global emergency declared by the World Health Organization. This outbreak was covered by CTV News to educate and urge eligible residents to get vaccinated, as Toronto and Ontario as a whole shared its experience with several active cases. About 93 positive cases were reported around the time the article's release, which was also almost 5 times more than the previous year.
Now that we know what monkeypox is, we can talk about why it's important to nurses and healthcare professionals. Firstly, vaccine-wise. As monkeypox spreads globally but also widely across the GTA, it is important for nurses and healthcare professionals to guide clients to where they can access the vaccine to protect themselves, their families, and the community. Secondly, for advocacy reasons. As we learn more about monkeypox, nurses must take into account their client's health history and risk factors to advocate for vaccine access, especially for higher risk groups like the LGBTQIA+ community. Lastly, educating people about the monkeypox is key to preventing the spread. By providing accurate information, nurses empower their clients to make decisions that support their health by understanding their risk and taking preventative measures.
Our first article, a review of the past, present, and future of the monkeypox virus by Hirani and others, talks about the spread of mpox in 2022 and clarified that the decrease in immunity after smallpox immunization has exposed the people to more vulnerable states. The current vaccines like Jynneos are effective but may not work in the long run. The 2022 outbreak was especially concerning because it spread mostly beyond Africa and affected mostly men in their 30s compared to the earlier outbreaks that affected young children. The authors highlight the importance of good surveillance, equal access to vaccines for everyone, and community education. They also emphasize that similarly to COVID-19, an early response and respectful communication can make the population be prepared to reduce stigma in the affected community and manage the outbreak more effectively. While our second article, The Implications of Mpox Breakthrough Infections on Future Vaccination Strategies by Shamir and others, looks at how well the vaccine actually really works for people. For the cases that were studied in the article, it was found that the success rate of the vaccines like Jynneos is between 36 to 86%, which led for the symptoms to become milder and people recovering much faster. So they reached a conclusion that neither the natural infection or 2 doses of the vaccine actually provides a complete protection as people continue to be infected with mpox. Therefore, the authors suggest that long-term studies would be beneficial to learn the duration of immunity and inform the strategies of the booster and vaccines for future use. Overall, both of the articles highlights how mpox continues to be a global health concern even with the availability of the vaccines. Together, these studies suggest that an ongoing surveillance, education, and collaboration must be done to prevent any more future outbreaks and build more prepared and resilient healthcare system for everybody.
The journalist presents this article using a critical social theory and social justice framework. The usage of those two frameworks allows for the journalist to raise awareness about both the importance of vaccines and the communities who are more at risk of it. The article focuses on how the LGBTQ+ community is at more risk of contracting this disease. This is much like how HIV was once portrayed, which has definitely contributed to some stigma around the disease. The way the journalist wrote the article does a good job of highlighting the importance of being vaccinated, educating people on how fast the disease spreads, and how most carriers of the disease can appear asymptomatic for a while. It also highlights how the most at-risk community, the LGBTQ+, need improved access to the vaccines for this disease. This article does lack a very critical framework, however. The journalist fails to address this issue using a phenomenological approach. He does not include any lived or anecdotal experiences from those directly and indirectly affected by this disease. Without the direct experiences from people involved, this article can feel more factual than emotional. It is missing that deeper human understanding that a phenomenological framework would have provided. Overall, the frameworks that the article used did educate people enough on the virality of the disease and who is at risk, but a lack of a phenomenological approach did get rid of the possible emotional depth that could have been there.
When it came to the cultural considerations, the article mainly focused on the failures and public health response both in the past and present. In this section, I'll be focusing on some of the past. Firstly, the article criticized the structural issues of the healthcare system. In order to tackle such outbreaks, countries need to be equipped with what is called operational surveillance systems. This is crucial because it trains public health workers on what to do in such extreme situations. However, many countries are still lacking such services and equipment. This resulted in ineffective testing and inappropriate diagnostic facilities, forcing samples of infected patients to be sent overseas, further increasing the chances of the disease spreading. Now, the final one in this section will be trust. COVID-19 taught all of us an important lesson from the start: communication. In the beginning of the COVID-19 pandemic, it was proven that having early, continuous, and clear communication was vital in preventing misinformation. Being able to maintain such strategies with monkeypox will play a key role in diffusing the public's perception of public health agencies, as well as decreasing the spread of the virus.
Throughout this presentation, there were groups of people who were considered privileged and who were considered marginalized during the monkeypox epidemic. Males, particularly part of the LGBTQ community, made up majority of the positive cases and faced most of the stigma surrounding the epidemic. People who lived in rural areas with less access to healthcare and vaccines, as well as homeless individuals, being more susceptible to overcrowded areas and unsanitized conditions, were among the most at risk for catching monkeypox, making these people more marginalized. On the other hand, people who experienced the opposite, having access to vaccines and living in clean, stable housing, had decreased chances of infection, experiencing a level of privilege. These individuals usually came from high-income families and were less affected by social stigma.
The final part of this presentation covers nursing implications. The nursing implications for this topic essentially fall under the umbrella of public health advocacy and education. Nursing implications include calls to action for continued vigilance of individuals susceptible to monkeypox, for nurses and other healthcare providers to educate themselves and clients regarding the risk and symptoms of mpox, and to advocate for safe and accessible vaccination sites for vulnerable groups. These actions tie into the essential duty that nurses have as frontline healthcare workers and advocates, ensuring justice and safety for marginalized and oppressed groups, particularly sexually active LGBT men, who are statistically most threatened by and susceptible to the mpox outbreak, as noted by both Shamir et al. And Harani et al. In their respective publications. Nurses should participate in promoting awareness and health literacy regarding mpox infection in the general public, especially among high-risk populations. For example, nurses are recommended to use contact, droplet, and airborne precautions, such as the PPE listed on screen, to limit transmission when in contact with a client that has monkeypox. Nurses can educate potential clients on the risks of monkeypox by explaining that individuals with monkeypox spread the virus mainly from direct contact and droplet transmission, such as skin-to-skin contact or aerosol transmission through face-to-face interactions. This way, individuals at higher risk can take appropriate actions to protect themselves and others from monkeypox. With that said, in their 2023 article, Harani et al. Underlined the importance of deliberately avoiding stigmatization of historically marginalized groups of individuals at higher risk, emphasizing that vaccination status remains confidential and free from judgment. Also, public service announcements should clearly indicate where individuals may get vaccinated. Lastly, nurses should be active in advocating for safe and easy access to vaccination sites for vulnerable populations, as racial and ethnic minorities were less likely to be vaccinated against mpox, in spite of being more likely to be infected with mpox than non-racialized counterparts.